Good afternoon, everyone. My name is Leslie Smith, and welcome again to one of our USAWA Live webinars. Today, we are tackling the topic of perinatal mood and anxiety disorders within fathers or dads. And we have Jenny Dalton, licensed clinical social worker supervisor, as well as Charity Crawford, who is a licensed master social worker. So I want to welcome you guys to the conversation, an important conversation, and usually definitely one that's not talked about enough. How are you ladies doing today?
Good.
Doing well.
Good.
Social work is
Awesome.
good.
I know I was like social work. It's all about social work today. Social work and
No,
PMAS.
that's right. I think that speaks a lot, of course, to your profession. And I'm very grateful to have you guys part of the team. But let's go ahead and jump into this conversation about perinatal mood and anxiety disorders within dads. From your experience in your education, what are the key perinatal mood and anxiety disorders that you know that have or can affect men? And like, how do they differ from being experienced by a woman, I guess?
Yeah, so just from my experience, it's more so the postpartum depression, postpartum anxiety that shows up untreated, or sometimes it can turn into more of like those generalized anxieties, OCD, post traumatic stress. The difference with, I think, the stereotypical kind of postpartum depression in women, a lot of times you'll find, there's a lot of fatigue. There's a lot of, oftentimes there's a lot of crying, a lot of emotional kind of release. Whereas in men, a lot of times it'll come out, you'll find more like isolation and withdrawal from mom and baby. You might find more anger, irritability. There is, of course, that fatigue component. Oftentimes, just like what a woman might experience. However, there's not often. Sometimes there can be, but there's not as often that bigger emotional release or outward emotions. It's more a lot of like internal things. And then, of course, just kind of like that withdrawal, isolation, and irritability, and just that feeling of helplessness sometimes.
Hmm. And what is the perinatal period? Does that differ between genders, or what do they say the perinatal period is in fathers or dads?
Yeah.
So sorry. No, so a lot of times in that postpartum period, so most commonly the research, of course, there is not as much research, but the research has shown that it's most common within the first trimester of pregnancy, and then when the baby is about 3 to 6 months old. Now, of course, that's generalized, like statistically, but it does occur in other periods. So when we think of the perinatal period, we think pregnancy, usually up to a year postpartum at least. So
Okay.
when we're looking at that postpartum perspective, it's usually any time within that first year, those symptoms can develop. For dads, it has been shown to be more so when the baby is 3 to 6 months old.
Oh,
However, it can, or in the first trimester of pregnancy. So it's kind of interesting. Like it can happen at
mhm.
any time, but those are when it's most common or when it is mostly noticed.
With I know there's not a lot of research, but from what you guys have seen or read, how common are these mood disorders in men?
Yeah. So, with I'll say first with women, we'll see is 1 in 5 to 7 women will suffer or struggle with postpartum depression, and then with dads, it's 1 in 10 dads make it
Mm.
depression, postpartum depression. And then, so what Jimmy's talking about is the anxiety disorder that the research shows us about 18% of dads, right? So, I have to say that PMS does not discriminate, right? So even
Right.
if the percentages are are lower in men, it's still occurring, and it's still a pretty high rate, like 18%. That's a lot.
Mm-hmm.
That's a
One in
lot.
dads, like arms out to 10 people, one of them, may suffer from postpartum depression, right? So this
Absolutely.
that I think there's not like you mentioned, Leslie and Jenny, there's not a lot of research behind it. And that is a limiting factor to access to care as well, right? Because it's something that's not even on your mind, right? It's not
Right.
that guys or dads or even moms or family members, people, your loved ones are not considering that. So they're not looking for those symptoms that Jenny talked about: isolation, irritability, aggression. They're not looking for, okay, hey, what's going on? You're a little weird. You know, that people think about, just generally think about depression as being sad, right? Um,
Mm-hmm.
you being withdrawn, but we're not thinking, hey, there's gender specific considerations. So those things just they go masked, right? Now it's
Mhm.
depression and masked. Excuse my braces. Depression. And we just often there's these things are occurring, these symptoms are present, but you don't even know because you don't know what to look for.
Right.
Yeah. Wow. Are there any particular factors that I know you just said you don't know what to look for, but does research show any particular factors that may increase the risk of the PMADs in dads?
Of course, when you have, when we look at, so obviously, if your partner is experiencing any sort of PMAD, you are at more of a risk. We also want to
Mhm.
look at previous history of anxiety or depression, whether with the dad or within their biological family,
Mhm.
just history of that, and also just resources as far as like isolation or do they live in a rural community, the resources that are available, that amount of support that's available. So that's going to be something that is really important to consider as well, that they are going to be at a larger risk. You might find it more in depending on how the pregnancy progressed,
Mhm.
depending on delivery and kind of what happened around that. So there are a lot of those symptoms to consider as well, or just those scenarios.
And that makes total sense,
Mm-hmm.
for that to happen if they're kind of, in not the same experience, but part of the experience, right?
Right.
Um, well, okay, let me ask you this. Then what are any unique challenges that men may face to recognizing and seeking help, right, for any of these feelings that they may experience during this perinatal period?
Excuse me if I repeat what Jenny said.
That's
My
okay.
internet is not cooperating. I apologize. So what I'll say is that men don't get the same checkups that women do, right? So
Mm-hmm.
Mhm.
women are going in, at 6 weeks, and additional follow-ups as needed, and there's screeners that they're administered, right? Checking for these symptoms. So that's the first access to care, right? That's a barrier. And then a lot of times men don't have the same support systems that women
Right.
do. Um, and so those are two really big things, or
Mhm.
two really big entry points to where mama is going to, seeming like they are, typical or normal. Those screeners are so important because we don't just ask ourselves, hey, how am I, like, how is my sleep going? Like, am I hopeless or hopeless? Like, am I having any suicidal ideation? Like, we don't just typically don't just ask ourselves those. So those screeners help us, with our self supports, and then also, our primary care providers and our OBs are helping with that. And I just don't have that same access.
Mhm. That does make that is a good point because I don't know. I wonder how common, um, the non-birthing partner, as far as their presence or attendance is at that 6 week follow-up.
Right.
I guess that leads me into the question of how can healthcare providers um, include the non-birthing parent, or in that postpartum kind of screening that you're talking about, Charity?
I think that we always want to look at, of course, always education and just kind of informing them ahead of time,
Mhm.
as to kind of what to expect. And I think it's also we look at who is taking the children to their follow-up visits with the pediatrician, because even at the pediatrician, there are always the screeners that mom gets. I think back to my own experiences when I would go with the occasions that my husband was able to go. This was during the time of COVID, so only one person could go most of the time. So if he was able to go, they would always hand the screeners and the questions to me of like, it wasn't, how are you all adjusting? How is everything going? What does this look like? There was very much like, Mom, how are you doing? Which appreciate. However, you always have to kind of take into consideration. So I think it is just kind of that education and opening of like, how can we expand our screening? Especially PCPs, just general practitioners, when men are coming in for their checkups, when they're going in for wellness visits, asking, any life changes recently, anything like that. Oh, we've had a kid. Okay, so how is that going? Just really kind of even just talking about it is going to be really important, because I think there is still very much this misconception of, even some of the moms I see, when I tell them like, how is your partner doing with this? Because it is possible for them to develop XYZ, and they're like, what? So I had the baby. What is that? And I think there's still very much that impression that postpartum depression and postpartum anxiety and PMADs are hormonal. And yes, there is a large hormonal shift with, the changes in estrogen and progesterone, but it's not solely hormonal. So it's very possible for your partner to experience that as well. And so I think a lot of it is that education and just showing up in the community for that and normalizing it.
So I know you speak of go ahead, Charity, I'm sorry. Yeah, I know you speak of, some things that healthcare providers can do to help, like, kind of normalize the emotions or, changes that the non-birthing partner may experience. What else can therapists do within the behavioral health profession to bring more awareness to PMAD?
Are you good, Charity? Sorry, I didn't know with your internet. I didn't want to cut you off because I know it was like it.
Sorry, I keep going. It keeps closing. I'm sorry, y'all. I apologize. But so yeah, Jimmy was speaking a little bit to that. I'll also say that as therapists, just kind of being aware of just our own bias and what we bring to the room, right? Having that understanding, having that education. We talk about hormone shifts. Men experience hormone shifts too. That's what research shows. Perinatal period. So, right, they may have decrease in their testosterone, increase in estrogen, and that also makes them more prone to depression. And then also being aware of any kind of group therapy that are men lack that support network, so that group therapy is going to offer them a don't have. And then also, just we know guys have a hard time with feelings, right? So if it's like, hey, a role thing, then maybe I'll be able to do that. I know, just being aware of that in your their network. So maybe if you're able to refer to those types of things, and they'll be less uncomfortable.
Right.
They have that group setting and just that harmony. Also, I would say therapists recommending couples therapy, right?
Yes,
so
absolutely.
Yeah, because that's a risk factor too. Because if there's disharmony just in your marriage, there's a lot going on there, then that's going to also increase your risk factor for depression, anxiety, all the things, right? So if we're working together as a couple to kind of get on the same page and we're adjusting, and it's going to help us to have more of a long-term conflict resolution. And so those are kind of ways that we can kind of just involve more of those greater ecosystems that they're a part of. giving them that building in support and actually helping to help their environment that they're in. So I'm in a stressful environment, it's impacting everyone around me, my spouse, the kids, my parenting, everything.
Yeah, good point.
Yeah,
Charity.
and that's another thing too, when you just to kind of bounce off that, depending on who you're seeing in the populations that you're working with, if you are, a perinatal therapist or with a perinatal population, depending on your type of work and your orientation and what you do with your clients, especially with a lot of my clients who are currently pregnant, towards the end of their pregnancy, one of the things that we will go over is we'll develop a postpartum care plan. We will go over like a symptoms checklist. Like, this is what we look for. This is what, be prepared, share this with someone. And so at that time too, is a lot of times like, okay, what is your support system going to look like? Do you have a support system? What do you want that to look like? And including the partner in that, if possible, and say, hey, this is possible too. So even doing postpartum care plan for the partner or for dad, incorporating that into those sessions for the preparation, as far as just kind of, because everyone needs support, and so including them in that as well is really important.
Are there any specific cultural or societal factors that I guess may influence how things are perceived and addressed in men? I think we know the answer to this, but can you guys expound on what those factors may be?
Yeah,
And definitely the stigma of, men
Absolutely.
in therapy, but just if we are being inclusive, gender inclusive, just non-birthing parents in general, what are some factors that may kind of create barriers?
Yeah. So if there, first of all, I'll say the stigma, just with men and just feelings, and I've had clients just say, I'm not supposed to have feelings, and I'll have feelings, and then when I do have feelings, it's like, why do you have feelings?
Without your feelings.
Feelings. What are those?
So battling that constantly, men and just in general, but just birthing the non-birthing parents, not being the primary parent, stereotypically, and so maybe they don't have that. They're considered to be the not babysitters, right? So hey, you're not the primary parent, so not the primary caretaker. So there may be a feelings of not being involved or not being included, and also not knowing where I fit in here, right? Like, where I fit in all this. They feel like you're not the primary parent, so I'm not sure how to move forward with that, and just that role change, right? And also kind of grieving, just not understanding that what we're grieving, right? We might be grieving the loss of that role, the new role, and there's just a lot of factors, a lot going on all at once, that contributes to that.
Yeah. I think it's also interesting to think about from a systemic level when we talk about insurance, how insurance is definitely set up for the birthing parent to receive the services after, especially if it's state funded, to receive the services in the perinatal and postpartum period, yet the non-birthing parent does not even qualify. Is not even eligible to receive those services from state funded programs. That's very disheartening when we look at the statistics and how prevalent it can be if diagnosed correctly within the non-birthing parents. So that is definitely something to keep in our minds as we work with the populations that we serve, right?
Right.
Are there any, so from your knowledge, are there any evidence